In the last 30 years, Idaho's population has nearly doubled. Barely 1 million people in 1992, little more than 1.8 million today. And with that sort of increase, you're likely to see an increase in infrastructure issues, healthcare hardships, and a wide range of problems on how to handle them, especially when you consider another number that has grown exponentially since 1992. Back then, the Centers for Disease Control said 1 in 150 kids, 1 in 150, were diagnosed with an autism spectrum disorder. In 2012, the CDC put that number at 1 in 36. This results in a long wait list for Treasure Valley parents who suspect their children might have autism but need a specialist to diagnose it, something that can take years, which is crucial time wasted for those families. Here's Andrew Bartline.
Moms have a knack of wasting no time when it matters most.
You start at your pediatrician.
Hi.
At an early age to ensure their kids are safe and healthy.
You go through your day-to-day life trying to help your kiddos the best you can while you wait.
The wait.
It's just been
Kirsten Rankin lives it.
life-changing for me. I'm a mother of 3 special needs kiddos. All 3 have autism.
All 3 detail a difficult story of getting the services and resources they need.
I went into it just scared and confused, and then you start calling to try to get your kid help, and you're told 18 months, 2 years, 3 years, and it's like, okay, but my kid needs help now.
If a child is suspected of having autism spectrum disorder, Full Circle Health says a general pediatrician could diagnose an obvious case. But autism is a spectrum, and a specialist is often needed to determine the level of nuance, and it costs time.
The wait list, for example, for my oldest was 18 months.
And that's just to get the appointment scheduled, not to actually be seen by the specialist.
He would be very violent, very aggressive, just couldn't calm down, couldn't sit still. Anytime we took him out into the community, he would just dysregulate, scream, yell. What people don't get is they don't choose that.
It's one of the more frustrating parts,
And it's nobody's fault.
including the doctors and specialists.
They're incredible. They're incredible people. There are some amazing therapists and doctors in this valley, and they very much want to help, and their staff very much wants to help.
There just isn't enough of them. And Full Circle Health's Dr. Perry Brown says there are few local resources to evaluate autism spectrum disorder. And just because a specialist isn't available
And a lot of times you get stares,
doesn't mean they aren't seen.
you get comments, and your kids are judged. Pretty traumatic experiences, being judged for things that they can't control.
And a mom can only do her best too.
Being persistent. Persistence is key.
It's more time than Kirsten wanted to spend,
The last 2.5 years have been a journey.
but worth the price.
I know with my oldest, it's been life-changing for us with him being on the right medication because he's getting the help that he needs. He's getting the services that he needs.
Costs a lot of real money too, not just time. Kirsten was explaining to me her individual situation with insurance, Medicaid coverage, what they could or couldn't cover. Her youngest, she says, is nonverbal. He has very specific services that he needs. One of those would be a helmet, for example. She said it took a year just to get through the process of finding a referral, getting a fitting. That whole year-long process, they were concerned that their son would hurt himself in the meantime. So you imagine multiplying that by 3 across 3 kids. Very difficult individual situation for her and her family, but across the board, there are families that are waiting 3 years to find out what exactly is my kid's situation and what does my kid need.
And not to simplify this, but of course, this is just another example of the growing pains here in Idaho. When the population increases like that, you're going to get a wide variety of people that move here and that are born here. And the limit when it comes to how many doctors stay in this state.
Yeah, I know we've reported that across the board on other things, other situations. It just seems to be another wrinkle, and there's a need for health care that maybe isn't being filled right now.
Right.
Try and get in touch with St. Luke's on what their situation is, and we should have more from them later today. We're going to get that in our web story here at ktvb.com.
Okay, thank you very much, Andrew.